What is secondary sleep apnea due to depression? Veterans. Have you ever wondered how depression can affect sleep? For veterans, this connection can be particularly significant. Secondary sleep apnea due to depression refers to a situation where sleep apnea arises as a result of depression rather than being a primary condition. Sleep apnea is a disorder where breathing repeatedly stops and starts during sleep. This can lead to loud snoring, gasping for air, excessive daytime sleepiness, and even morning headaches. There are three main types of sleep apnea: obstructive, central, and complex or mixed. Obstructive sleep apnea happens when the airway gets blocked. Central sleep apnea occurs when the brain fails to send the right signals to breathe. Complex sleep apnea is a combination of both types. In veterans, depression is a common issue, often linked to the stresses of military service. Symptoms of depression can include ongoing sadness, loss of interest in activities, and fatigue. These symptoms can disrupt normal sleep patterns, leading to sleep disturbances that may worsen sleep apnea. For instance, depression can cause poor sleep habits, changes in how the body controls breathing, weight gain, and side effects from medications. All these factors can increase the risk or severity of sleep apnea. The relationship between sleep apnea and depression is two-way. Sleep apnea can make depression worse by causing fragmented sleep and lowering oxygen levels at night. This can negatively impact mood and cognitive function. On the flip side, depression can worsen sleep apnea symptoms by disrupting sleep architecture and how the body regulates breathing. For veterans, understanding this connection is essential, especially when it comes to diagnosis and disability benefits. To establish sleep apnea as secondary to depression, a sleep study must confirm the diagnosis. Additionally, medical evidence, often in the form of a nexus letter, is needed to link sleep apnea to service-related depression. The Department of Veterans Affairs rates sleep apnea secondary to depression and anxiety on a scale from 0% to 100%, depending on the severity of symptoms and treatment needs, such as the use of a continuous positive airway pressure machine. Recognizing this secondary relationship is vital for veterans seeking proper medical care and disability compensation. Treatment usually involves addressing both conditions at the same time. This may include using therapies like continuous positive airway pressure for sleep apnea and counseling or medication for depression. Early intervention can lead to better sleep quality, improved mental health, and overall functioning. Secondary sleep apnea due to depression in veterans is a recognized condition where depression contributes to the onset or worsening of sleep apnea. It requires careful diagnosis and coordinated treatment to manage both disorders effectively. Understanding this connection can have a significant impact on veterans' health and their claims for benefits.